So the stroke imaging talk, it's going to cover kind of three main things. One, it's going to cover some pattern recognition of different types of strokes that you can see on MR imaging, focusing mostly on non-territorial stroke patterns, those being the less ambiguous types, looking at ones that are typically more challenging that are non-territorial, such as like a hypoperfusion etiology or anoxic injuries or venous infarcts. Then we'll look at, atherosclerotic vascular disease is the most common cause of strokes in the head and neck, and we'll look at atherosclerotic vascular disease imaging features on neuroimaging in the head, separate from the neck. Given the different size of the vessels, there's different imaging features and also different methods of detecting, vulnerable plaque features and causes of the underlying infarct. And we'll also look at some differential diagnoses that may be commonly confused with atherosclerotic vascular disease, intracranially looking at vasculitis and reversible cerebral vasoconstriction syndrome or Moyamoya disease, and then extracranially looking at dissections and carotid webs, fibromuscular disease.